My role is really working with Africans in Lanarkshire. And what I do is it's like a dual role because I support people living with HIV. And then I deliver outreach that involves making sure that we are sensitizing Africans about, how to keep themselves safe from contracting HIV, use of safe sex materials, delivering, community testing. Because mostly when you look at it, some people really live very, very busy lives. So they might not have a chance to really maybe access services from the mainstream, like the primary care. But when you really go to communities and you're meeting them, the concern is it's easier for them to know what's out there and how can they access testing? How can they protect themselves? Where can they get condoms? And we also deliver the condoms to the community. So we make sure that we are bringing services nearer to the community. But of course, with the COVID, most of those things have really changed. We are working differently. I think since COVID, it has been really learning as we go, how do we effectively reach people? For example, we've got a challenge. The only part that really I go out and meet people is not even meeting them at social distancing. I deliver milk to the mothers. We've got some HIV positive mothers that are supposed to really feed their children because of avoiding mother to child transmission through breastfeeding. So that's the time where I need to really go to the houses and deliver at the door, deliver the milk. But for outreach, it has really changed tremendously because I can't really go into the community anymore, which I really miss because I loved going to churches and interacting with the community. And this gave them, the intervention we're using were basically for the community and with the support of the community and the ideas, what we do, because we talk about Africa, I work with Africans, but Africa is a very, very diverse continent in terms of our cultures and everything. So every day is a class. You learn about the sexual practices of different cultures, different tribes, and they will tell you how you can really work with them without really being the person who is kind of judging them with their the ways they conduct, they look at sexual health in their communities. So it's a two-way thing. You really you're guided by the community, and and most of the work I've done, in fact, have been led by the community, which is fantastic. One thing is that if you're going to look at, there's certain issues that really hold people back. And you can't deny it with things like when you're saying Black Lives Matter. Those things really, racism affect people, and it makes them cagey, it makes them wary to access services because it might be one person who has called that person a derogatory word in the streets. But certain time, one negative, people start really tainting everybody with the same brush. So people really feel, I don't want to go to my GP, and what if that person is equally racist and what? So they end up not accessing services. They might access services when it's too late. And when, with health, if we take our cards for MOTs, we need to really make sure that people are, engaging with their dentists, engaging with their GPs, engaging with sexual health, testing for HIV. When you look within the African communities, most of the testing, people are diagnosed late. Part of that could be, it's a multi-valuable. When you look at, there's so many variables there that could be leading people to test early. But some of those things could find that, people are cagey to really access services because they assume, oh, what if I go there and test positive? I will even be judged further, So it's those challenges. When you look at it also, poverty and unemployment. Within the African community, you find people with PhDs, but literally they are doing cleaning jobs. They can't get a job. You talk to people and say, I've tried, I've got the books, but I can't get a job. So it's that challenge. Why are they not getting those jobs? Maybe it could be an underlying issue there that certain time we are not really facing as communities to say, this issue is there, because certain time, each time people talk about racism, they say, oh, now they're Black, they're using the race card. But these things affect people,